Good morning. You've heard a lot about polio already in this conference, and so should you, because Rotary is so critical, so central to the polio eradication effort. We've heard the inspiring speech by Paul Harvey on the National Immunization Days in India, and the nice words by Her Royal Highness Princess Anne. What I would like to do today is update you on where we are with the Global Polio Eradication Initiative, and also explain to you why it is so critical that Rotary continues to support this campaign until the very end. We are all sort of tired. We heard a president say, it's been more than 30 years now. Of course, we are tired because we're losing patience. Why have we not yet eradicated polio? I'm going to explain to you how difficult it is to actually finish, but it is feasible, and how important Rotary has been so far, and how critical it is that Rotary continues until the very end. No other intervention in public health than vaccination is so critical to global security and stability in the world. Polio is the prime example of the power of vaccines and its contribution to securing stable environment and stable world. The polio vaccines were first developed in the 1950s, and quite rapidly in the developing world, the diseases started to disappear. However, it has remained a very important and disastrous disease in many, many countries. And in fact, until very recently, polio was the leading cause of disabilities in the world, even more so than landmines. In 1985, when we started this effort, when Rotary started this effort, there were 125 countries where poliovirus was endemic. This was causing 350,000 cases every year. 350,000 kids were being paralyzed every year. That is basically one child every other minute. So in 1985, Rotary launched its Polio Plus program in Philadelphia to address this inequity between the developed world and the developing world, where we're facing so many disease. After the first successful support of a campaign in the Philippines, the Rotary International launched this effort to actually ensure that we will no longer have any kid in the world paralyzed. This was 3 years later, followed, and we heard that from Paul Harvey yesterday. He did insist on the difference of time between 1985 launch by Rotary International and the declaration by the World Health Assembly, all of the ministers of health of the world getting together and resolving to launch an effort to eradicate polio. This is an important effort that was launched. It was initiated by Rotary, but it was followed then by the World Health Organization, UNICEF, the Center for Disease Control of the United States, and later on by one of our very important donors now, the Bill and Melinda Gates Foundation. It is also supported by many important governments of the G7 countries, and the UK, and the UK Department for International Development is one of the most generous supporter of this effort. UK has already contributed over $1 billion to this effort. And of course, this $1 billion that has been contributed by the UK, a lot of it has been influenced by Rotary and Rotary's interaction with the governments. So thank you, Rotarians, and thank you for the efforts that you're making to raise funds, to raise awareness about the disease, even though the disease is disappearing and many people actually don't know anymore what this disease is, and to engage politicians in the effort to actually mobilize the resources that are still needed until we finish the world. Now, We heard also yesterday of the many, many volunteers that Rotary is sending to the field to help actually do the work on the ground. National Rotarians and international Rotarians going to those countries that need our support. There's been a lot of progress since 1985. We now have only 3 countries where the disease continues to be endemic: Nigeria, Pakistan, and Afghanistan. In 2017, we had only 22 cases. Only, but these are too many cases. This represents a 99.99% reduction since we started in 1985. But this is not enough. What we need is 100%. We cannot afford to have this 0.01% of cases still occurring. Otherwise, the disease could actually come back. Polio is certainly at its currently lowest levels ever that it's been. And we really have the best chance ever to actually finish with the disease. It is, however, difficult. It is difficult because if we stop now, if we think that having the disease in only 3 countries is going to be the end of the effort, then we can actually run the risk of having this disease sort of reappear. It is a highly infectious disease. We've heard that before. Time and time again, we've seen in the past that the disease appearing in some parts of the world could actually spread to other parts of the world where many children are not properly protected against this disease. If you see this map of all of the cases between 2003 and 2017, and the arrows that show how the disease has spread from areas that were endemic to areas which had been once considered polio-free, but the disease was re-imported by travelers, by people that actually sort of carried the virus and actually infected children that were not protected, not properly protected against polio. These outbreaks have now stopped, and this is great. But if we don't eradicate polio, if we leave the virus survive in some places of the world, and we stop being sort of cognizant of the risk of reintroduction, quite rapidly, within 10 years, we could actually see major outbreaks in some parts of the world where children are not properly protected, and rapidly 200,000 new cases every year would occur. We cannot afford that. We need to finish the work. This is why we absolutely need to eradicate polio once and for all. Until we eradicate completely, and this is why it is continuing to cost so much money, even though we have cases only in Pakistan, Afghanistan, and possibly in Nigeria. We need to continue to vaccinate every year approximately 450 million children several times. 2.2 billion doses of vaccines need to be administered every year in approximately 50 countries to ensure that should the virus get reintroduced from those places where it still survives, then it would not cause an outbreak. This is what is costing quite a lot of money. We need to continue to conduct those NIDs that you had a description of yesterday in India, in 50 countries in the world, in Africa, in Southeast Asia, in the Middle East. These countries need to continue to protect their population because their routine health system is not strong enough. And if we really want to eradicate the disease, we should leave no place for the virus to be able to reintroduce and circulate. The other reason why this effort is costing money is that we don't only vaccinate children, we also need to track the virus wherever it is. And how do we do that? We actually investigate what we suspect could be a case of polio in all of these countries, actually throughout the world. You know, the suspected case of polio is what we call an acute flaccid paralysis case. A child with sort of some of his limbs or her limbs sort of paralyzed. So what we do is we actually have people that detect those cases of paralysis in the communities, in the health systems, volunteers, but also people that work for the Ministry of Health. detect those cases, then investigate the case, look whether the symptoms indeed correspond to a polio disease, then take some samples of the stools of the child that has been paralyzed. These stools need to be kept cold and then sent to a laboratory for testing to see whether we detect the poliovirus. We also, to be sure that we don't miss a case of polio, we also take samples from family members, because sometimes the stools of the person paralyzed will not prove positive for polio, but in fact, because they've been mishandled, they've been kept not cold enough, but the fact that we actually collect also from the community or from the siblings may actually help us detect the virus, and then we know it is a poliovirus. Every year we investigate approximately 100,000 suspected cases, and this is costing also a lot of money, but this is absolutely indispensable. We want to be sure when we declare polio eradicated that indeed the virus is not hiding in some places, some corners of Africa or Southeast Asia. We need to know immediately whether an outbreak of polio occurs so that we're able to respond as rapidly as possible and close that outbreak. But of course, our primary focus is to destroy this virus once and for all, wherever it may hide, and finding that elusive child, last child, who may not have been vaccinated. We look at and we face very specific challenges in this fight against the virus. And because we face very specific challenges which depend on the area in which we work, we develop strategies to tackle those challenges. Very specific and very targeted strategies, such as overcoming problems with access. So how do we access children in the northeastern part of Nigeria, which is under the control of Boko Haram and where vaccinators are not allowed to go in? How do we vaccinate children in the most remote places of Congo? How do we vaccinate children where we don't even know that there are villages? How do we vaccinate children in war-torn areas such as in Afghanistan? For all of these sort of specific challenges, we develop strategies of negotiation, of sort of mapping, of using satellite imagery to actually make sure that we don't miss out on any community. All of these strategies are defined with innovative sort of thinking to actually precisely tackle the last sort of remaining places where the virus might be hiding. Every child has the right to be protected against the disease, so that's why we need to find every last child and vaccinate him or her. We're closer than ever, we've heard that already, but we are closer than ever to having eradicated this disease. And because we need to think beyond eradication, and once eradication is certified, that is 3 years at least after the last case has been reported, the last virus has been detected, the last wild virus has been detected, we will need to make sure that we do everything that is needed to sustain a polio-free world. So we cannot let the virus come back, not from where it would be hiding, because we will have eradicated the natural wild virus, but it could actually be reintroduced by accident from laboratories which still hold this virus. And this is what we have in this endgame, which describes all of the necessary sort of activities to ensure that once the world has eradicated polio, then it does not come back. Containment, containing the virus in as few as possible places in the world, and avoiding that this virus could actually be reintroduced by accident is one of the important aspects of this endgame. We also need to ensure that the polio plus is really a polio plus, and that this plus serves a broader health agenda. Over the years, the infrastructure that the Polio Eradication Initiative has built, thanks in many cases to the resources that Rotary had been mobilizing for that purpose, this infrastructure can serve a much broader health agenda. It already has Health workers in polio eradication programs throughout the world have contributed to many other interventions. In Nigeria, they've helped sort of stop the Ebola outbreak. In Nepal, they've contributed to sort of supporting the populations after the earthquake. In Indonesia, after the tsunami. All of these polio workers were deployed already in the country and actually changed gears and started to help the population in these communities that were hit by another catastrophe, while still continuing their work for polio eradication. We estimate that approximately 50% of the time of people funded by the Polio Eradication Initiative to do polio work, surveillance, immunization, is actually spent to serve a much broader immunization or health agenda. And of course, as we get less and less polio, this time will sort of increase, but at the same time, the number of people that we finance with polio will diminish. So it's important that the governments themselves, if they want to maintain this capacity to respond to catastrophe, to earthquake, to outbreaks, actually take over the financing of these human resources that the polio program had been putting in place. I've given you a brief overview of where we are with the Polio Eradication Initiative, but I want to take this opportunity also to thank you again as Rotarians. And I must say, I myself became a Rotarian 6 months ago, convinced by a very small club in District 1710 in France, but a pretty active club. I want to thank you because of everything that you've done, and Bill Gates himself sort of made a very strong statement a few years back where he indicated that Rotary is the heart and soul of polio eradication. It is true. Rotary is the catalyst behind this effort. Rotary's continued engagement has been critical to where we are today, and it is critical to finishing the job. Rotary, of course, has many partners in this effort. The UK, as I mentioned, has been one of the sort of most important donors to the effort and contributed a lot of resources. We heard from Princess Anne yesterday, and you see here Charles also sort of contributing to advocacy around National Immunization Day in India. What is important also with the UK contribution and support to this initiative is the political advocacy in the Commonwealth countries or in the G7 countries, because having a voice of the UK state that it is critical to eradicate polio carries a lot of weight. Other countries, except for France, I'm afraid, other countries actually sort of contribute very heavily to these efforts. I haven't lost faith that we would actually get them, just at the time that we finish the job. And of course, as leaders in the Commonwealth, the UK has, an even more important role to play. 2 of the endemic countries are part of the Commonwealth. What Rotary started in 1985, in fact in 1979, is truly a global movement. Rotary was the first with a vision that we could eradicate this disease, the second human disease ever to be eradicated. Rotary has contributed more than $1.8 billion. And because of its advocacy, because of its sort of influence, because of the the role that Rotarian plays throughout the world, it has helped more than $7.2 billion mobilized from the public sector, from these governments that have contributed to the effort. We estimate that probably 50% of all of the expenditures of the Global Polio Eradication Initiative have come thanks to Rotary or Rotarians. And it is a sort of a huge contribution. Rotary, of course, continues to lead the way. Back in Atlanta, at the June convention last year, Rotary International mobilized the international development community to secure an additional $1.2 billion from all of the countries you see the flag of today. The UK flag is not there because the UK had a sort of election pretty close to those dates, and and waited a couple of months to actually announce £100 million contribution to the effort just August following the convention. So again, Rotary has played a critical role. Polio Plus is truly a perfect example of service above self. As a result of your efforts, we have averted 17.4 million cases of paralysis. We have saved 1.5 million lives. 20 million volunteers have been mobilized to support campaigns, resource mobilization, social mobilization in all of these countries. And we have vaccinated over 2.5 billion children. The effort that we put in place to eradicate polio has also contributed to a better understanding of what can be done to secure a better world and a more secure world. Because we know now how to reach children wherever they live in the world, thanks to the lessons learned from polio. We also know how to deploy human resources very rapidly to interrupt an outbreak. And we've proven that what we know for polio can work for Ebola, can work for Lassa fever, can work for many other deadly diseases if we have the infrastructure and the thinking that the polio program is put in place. A few years back, the Wall Street Journal did an analysis of Rotary International's contribution to polio eradication, and it came to a very clear conclusion. This is Ali Ma'alin. He was the last case of smallpox in Somalia in 1977. What we don't know is that Ali Ma'alin was actually a health worker who was detecting cases of smallpox. And the reason he contracted his disease is because he actually had detected 2 kids with smallpox and took them in a taxi and brought them to the health center to actually be sort of contained and avoid the further spread of the disease. So that's how he contracted the disease. He was the last case ever of smallpox on Earth. That's exactly what it means to eradicate a disease. That it means that nobody ever will contract this deadly disease because we've been able to eradicate it. And that's what we're trying to achieve with polio. Leave a world to our children, our grandchildren, where no one ever can be paralyzed by polio. Before I finish, I would like to just quickly ask you to save the date. We will have a special webinar organized by Rotary Great Britain and Ireland in trying to give you more details on Pakistan and Afghanistan, and that's going to be on the 4th of June from 6 to 7, and we'll share with you more details very soon. And of course, additionally, if you have questions on the current status of the program, how we actually gradually reach children in Nigeria, in the northeastern part of the country, and we now are down to a very small pocket of children that have not been vaccinated thanks to the strategies employed. I'll be at the coffee break available to answer any question in the polio booth over there. And of course, if you don't want to ask questions, you can just come and ask for a beer. It's only £10. Finally, 2 messages, and perhaps you'll think that I'm repeating myself, but thank you, Rotary, for bringing us so close to finishing the job. Thank you for all of your efforts. Thank you for your dedication. Don't lose faith. We are going to eradicate the disease. We are going to finish the job, and you cannot, at this stage, sort of give up, because this is what you've been working, many of you, for so many years. We will finish the job, but you just need to be patient and continue with your commitment and dedication. It is critical that, as I mentioned, we do not lose faith and that we actually finish the job to leave a polio-free world to our children. So thank you very much. Please keep up the good fights. Thank you.